Okay, hey y'all, I am Kelly Kirby. Gosh, the 15 years is going to turn into 20 next year, so I'm just going to keep saying it over 15 years. But I've been doing this a long time. I have worked in a lot of different areas. Currently, I am here at Seattle Children's and Psych Department. I have a clinic where I see youth with co-occurring disorders. But then you may also see me down in the emergency department trying to help out with mental health evals. And I also work on our site consult team, so the hospital consult. So if there's an issue with a youth that has substance abuse and mental health, I will step in for that. Otherwise, if it's just a straight substance use, typically our awesome social work team will take just they need referrals for substance use, and then they can always I don't know. You can add a request. They can always consult with me. I just cannot take all of the staff, I just can't take all of the consults anymore. I used to way back in the day. But yeah, this is me. But yeah, to just keep going, I don't have any disclosures or anything like that. Those are our next slides. And this is being recorded, correct?
Sure. Yeah.
Yep, that's what I usually like to do. All right, thank you. You might be filmed, no disclosures. Really quick, here's our kind of objectives. Just want to briefly review kind of a baseline for what addiction is and the diagnosis for addiction. I'm not going to spend too long on that. I usually don't have to convince people that opiates are addictive, so that's usually not a hard one. Discuss the current trends in youth opioid use and misuse. That's kind of where I'd like to spend the bulk of time, because I think that's the most interesting. But and then review kind of the treatment options for youth with opioid use disorder, including the medication-assisted treatments, and then discuss kind of Washington's naloxone distribution plan and where that is right now. And so that will be our agenda. I do always like to know kind of like what you hope to learn from this talk. And we do have our objectives. I can try to maybe get them in that general direction. So if you want to add it to the chat, kind of like why you're here, what you're hoping to learn. I know that sometimes I go to talks and I'm like, I already know all this, like, let's keep going. So I'm going to try to kind of, if you want to put that in there, I would love to hear kind of what y'all want. And we will have time at the end for questions. So I love. Pardon?
If folks want to just put, I was going to say, if folks want to put their what they're hoping to learn from the talk in the chat, and I can read them out loud because I don't know if Kelly, you can see the chat while you're sharing.
So I can see, so they pop up and then they go away. Okay. So.
Oh yeah. So current trends in the crisis as reflected in the youth populations. I am a high school nurse and I am hoping to understand the law requiring Narcan in school, and whether or not this issue is impacting middle school students.
Oh, that's great. I worked in the middle schools for 9 years, so I know that well. So yeah, thanks y'all. I don't, and I did work in the schools, and I don't know. When I was in the schools, I know we were at a training, they were giving out Narcan, and my supervisor was there and she was like, that's not for us. So that was like 2 years, well, maybe 3 years ago, time's floating by. But I'm hoping they will allow it. I kind of almost feel like it's, as I've said for our hospital as well, I mean, I feel like it's almost, dangerous to not have it, like to not give it out. So that's a great thing to check on, for future. And the COVID-19, the trends. Yeah. Well, feel free to keep those coming because we will have questions at the end. I know a lot of y'all are health professionals. So I just kind of want to start with the basic and to also just clarify, like, I apologize. I use kind of opiate or opioid kind of interchangeably. I realize that they do have differences, kind of technically, but I always think it's easier to say opiate, but like the diagnosis code is actually opioid use disorder. But yeah, obviously like an opiate is natural, and it's kind of like morphine, codeine, opium. those types of things. And then you have your more opioid that are like our semi-synthetic ones, hydrocodone, oxycodone, heroin, which is always interesting because, you know, the creation of heroin was to help with the morphine issues that we had going on. And so it's like, oh, the great cure is heroin. And we all know that was not a great cure. And our brain think it's the same as morphine. It's just a higher kind of dosage. And so that's, you know, what's out there. And then we have our synthetic methadone, fentanyl, which we'll talk a lot about, tramadol, those kind of things. So just to kind of clarify, and I apologize if it annoys you that I go use them interchangeably. I don't mean to, but it's just, I talk about it a lot. So, you know. The synthetic versus the botanical, just kind of starting off with that. It's obviously it's cheaper to manufacture. You have a lab versus a farm. It's easier to hide, easier to transport, and it's very inexpensive. So we'll talk more about this. I just kind of was pointing that out. Just kind of briefly going over the criteria for substance use disorder. And so there are 11 criteria, and people either go into a, well, no substance use disorder, mild, moderate, or severe, depending on the amount of symptoms that they have. And we'll just kind of like briefly go over these, and they're, you know, physiological, psychological, behavioral, and, you know, functional impairments that we look into when I'm diagnosing someone. And so it's kind of things like it's taken in larger amounts over a longer period of time than intended. There's a desire or this is a big one, right? Unsuccessful efforts to cut down or control the substance. This is always kind of tricky with youth sometimes because they will not have tried to stop. And so I'll be like, have you ever tried to stop? They're like, no, like, why would I? So sometimes I can't lay that one on them, but I think for a lot of, you know, adults, we, you know, understand like trying to stop something. A great deal of time is spent in activities necessary to obtain, recover from the effects of this, recover. Obviously, craving is actually one of the diagnostic tools, and that's a strong desire to use the substance. Recurrent substance use resulting in a failure to fulfill major roles at home, school, work, those kind of things. And I think that's just really, you know, we're kind of looking at life. How is this drug impacting your life? And this is a perfect one. 6, continued use. Substance use despite having persistent or recurrent social or interpersonal problems caused by the substance. So like problems with parents, problems at school, friends, important social, occupational, recreational activities are given up or reduced. Although youth will always tell me, I didn't want to play soccer anymore anyway, or they'll always kind of have their excuse. However, you know, I'd be like, especially when I worked in the schools for a long time and I'd see kids for years, and I'd be like, you wear a soccer jersey every day, and that's all you talk about is being a soccer player, and now you're not interested. Recurrent substance use in situations where it's physically dangerous. And I would, you know, I always include just even having to go get the substance, the places you have to go, some of the things people have to do, that puts them in dangerous situations, drinking and driving or using and driving. It's continued despite knowledge of having a persistent or recurrent physical or psychological problem that's likely to be exacerbated by the substance. And so, you know, you're not able to really do your mental health therapy or have your medications work because you're taking the substance. Also, like a lot of times with like opioids, they find that when people go into like, you know, they have chronic pain, all this pain, and when they go into detox, they come out and they don't have pain anymore once they're off of the opiate. And I know there's been studies that it kind of contributes to, it ends up contributing to pain and all these things. So, you know, that's one of those things. And then the basics that we all kind of know, tolerance and withdrawal. And those are pretty significant and easy to understand, especially with opiates. So that's just kind of the basic criteria for addiction when I'm looking into that. And I'm really just kind of looking, it's really about looking at how someone's life is impacted. And so this was a little hard for me when there was virtual school, because we had a lot of youth that weren't doing school. So and it was like, is it because it's virtual? Is it because they're using drugs? And this was, I kind of had more of this issue with marijuana, but it was like I had a few youth that I got referred to me from clinics, and it's like, well, I can't. Maybe they have a little tolerance, but not much. They haven't tried to stop. They're in trouble with their parents because their parents maybe found a vape or something, but they didn't have problems before that. Like, and then the school thing was really hard because if they had been in school, there probably would have been a drop. It had kind of been like normal school. But when it's virtual, a lot of kids have trouble. So it was really hard to navigate that one in terms of diagnosis. But kids are kind of back in school, but they're still having a hard time adjusting. So that one gets hard. And so the criteria has been a little harder with the world we've been living in. But it's really, when I talk to youth about it, they'd be like, they use every day or they do this. And I'm like, really, it's kind of like, how's it impacting their life? So you can have someone that's a binge drinker and they drink, every 3 or 4 months, but they go out, they wreck their car, they, spend all their money, they maybe, like get in a physical altercation. And it might not be every day that that's going on or weekly, but when they do, it really impacts their life. And probably their loved ones are sitting around like, oh, I hope that they don't drink again. So it doesn't have to be daily. Oftentimes it is, but there's just a lot that goes into it. The drug trends with youth will focus a lot on fentanyl. Yeah. Um, I'm going to look more at like local trends. So if you're not King County area, I apologize. And then kind of the overdose trends and those kind of things that are just really related to opiates. So just start with the big one, fentanyl. Ugh. It's a synthetic opioid. It's 100 times more potent than morphine and 50 times more potent than heroin. Yeah, who knew? We would be like, oh, I wish they'd go back to just pure heroin. Yeah, so it's a really strong, dangerous drug. Obviously, I'm sure you all know it's approved for treating, severe pain. It used to be, I don't know if they're doing it, it was like in a shot patch or lozenge, and they would take the patch. They used to take the patches and just like, you know, get the fentanyl out there and mix it in with other drugs and stuff. So, but they don't really need to, drug dealers don't really need to do that anymore because it's just kind of flowing in. To give you an idea, because people would go like, why fentanyl? Why is this going on? 1 gram of pure fentanyl can be cut into approximately like 7,000 doses for street sale and manufacture. This is according to the DEA. So it's just business. It can make a batch of pills go really far, whether they're mixing them with something like, you know, Oxycontin or oxycodone or something, but it can take those, 100 pills and make them into, thousands. So it's pretty much, because it's cheap, it's cut with a lot of things, and because it's addictive, right? That's kind of the goal for a lot of drug dealers, even though, as we know, it's very deadly. Um, it's starting to get some street names, and it didn't really have that before. Parents, when I did something at the school, they were asking if I was teaching the kids the street names so they would know, which I was like, but a lot of the street names were just like the same names that they had for heroin, because at the time, this was probably like 2018, people weren't going after fentanyl. They were still wanting to use different opioids and pills and heroin. And so that wasn't they weren't going like, oh, where can I get some fentanyl? It was kind of getting cut into the supply. Unfortunately, that has changed. I have a little slide about that. But yeah, so these are kind of some of the street names that they have. As soon as people start going after it, there's some of them, the China ones are kind of similar to like some of the heroin street names that they used to have. But yeah, Dance Fever, Goodfellas, Great Bear, like it's getting more and more prevalent, unfortunately, even with youth. To kind of give you an idea of, there's also this Carfentanil that's out there, and there is methylfentanyl as well. All kinds. I don't I'm not going to get into those because I got enough, really. I just wanted to put it out there for knowledge sake. I got enough to deal with fentanyl, but I did want to kind of put it out there. But you can see by this photo, it's just the fatal doses comparison. So the one, is the heroin, which, is not a lot to begin with. And then you look at the fentanyl, which is just, I mean, that's less than a salt packet, right? The heroin might be a full salt packet or sugar packet or something in comparison. And the fentanyl is just, I mean, traces almost. And the carfentanil is like one little, just speck of it. So it's highly, all of it is just highly potent and dangerous. And it's unfortunately, it's getting bad out there. The carfentanil is difficult to reverse overdose. And so hoping we kind of come up with some better ways to do that. It's really hard, and been in this industry a long time, and it's just always like you kind of do one thing, and for some reason the dealers, the addicts, everyone's like it feels like they're always a step ahead of us. So like, the opiate, when I started here in 2009 and I was working in adolescent medicine clinic with Dr. Walker and Dr. Shao, I mean, I'd see a lot of patients with Dr. Walker, and that's when I really realized in 2009, I was like, oh my gosh, there's like an opiate epidemic. And we saw a lot of youth with heroin, and it was kind of from the prescriptions and then, the lawsuits, and they were kind of changing. Like I remember the oxycontins had the time release, and you couldn't crush them up and use them. And it was like, okay, yeah. And then as soon as that happens, the fentanyl's pouring in. So it's just always kind of this like trying to stay ahead of the game. So I always say prevention's the best. The drug trends, unfortunately tide has kind of turned. Youth are no longer just accidentally taking fentanyl. Many are actively addicted and seeking it out. So I have a lot of colleagues that are in the community that work with like, a lot of street youth and homeless youth. And, obviously the agencies I work with to refer youth. And yeah, they're kind of calling these, which King County has been putting warnings out for years of these blue pills, these M30 pills. But like their street name is Blues. And one of my colleagues was telling me like, yeah, they're just out there looking for, blues. And it's not like, oh, I accidentally had this happen. So, I know in Seattle Public Schools, when, 2019 school year started, there were a lot of overdose deaths. And from what I could gather, because, people kind of sometimes, we don't get the best information when you work at the schools. They're not always telling you everything that goes on. But what I could tell, because I had a lot of youth that in my middle school that were friends, they knew these people. And what I kept hearing was it was just accident. They didn't believe it was a suicide attempt. They didn't believe, they thought they were taking fentanyl. It was always kind of, they were using something else, trying something else. And, it was very upsetting. And it was impacting, I know, my middle school students. When I was working in the middle schools, I did not see as much of the opiate use there. Now, of course, I worked in two middle schools. I was at Eckstein from 2010 to 2015, and then I was at Hamilton from December 2016 until 2020 when I came back to Children's. So I didn't see a lot of that. Saw more of marijuana. And I think too I did another talk on marijuana, so I will try to keep it opiate focused. But I think, our THC content in our marijuana is really strong. And so, the vaping, the dabbing, all of these things that youth are doing with this high THC, what I'm seeing like in clinic is just a lot of youth that are like the marijuana is not working for me anymore. It's not doing it. And they're moving on to kind of other drugs. So I kind of see in the middle school, starting with like the vaping nicotine, maybe trying, marijuana. That's what I was experiencing. Maybe some alcohol, different things, or edibles, like those kind of things I wasn't seeing as much. But, I haven't been in the schools for a little while. even when I was working in the schools, I wasn't in the schools. And so, yeah, it's kind of where it's starting. And then I know in 2019, I mean, Dr. Walker and I had we had 4 patients we were seeing that were using heroin, and they all went to the same high school. And so she requested I go talk to that high school and let them know they have a problem, because a lot of times the youth we were seeing, their problem wasn't all those things we went through diagnosing. Like they were working to pay for their habit, but it was getting too expensive, so that's why they switched from like pills to heroin. Um, their problems usually were like, yeah, I'm running out of money, or my parents are starting to suspect some things, like, well, I've been working and I'm out of cash. And so so they come to the doctor. And so I was really interesting. So it's something that you definitely see in the high schools. Um, Kind of continuing with drug trends. So most street drugs contain fentanyl, um, Vicodin, Oxycontin, oxycodone, heroin, but it's not just opiates that are laced with fentanyl anymore. It's the methamphetamine, the cocaine, the ecstasy, Xanax, other street drugs, pretty much, unless it's like, maybe some LSD, or, a lot of times in Seattle, they get mushrooms locally. Those probably aren't laced. And if the marijuana is, I mean, typically I have a lot of youth that will only use marijuana from a dispensary, because there's black market cartridges, the carts, the kids call them. And some of those have been found to be laced with fentanyl. And I heard more about that on the East Coast. But then one of the agencies I work with were saying there were some around Seattle. So it's out there. What I always say to people, and this is what, as if you're a health professional, this is what you can tell people. If it doesn't come from a pharmacy, assume it has fentanyl. And just because, and this is what my youth will tell me too, they'll say, well, I got it from my friend. It was his grandma's. It came, he had the pill bottle. And I'm like, okay, I can put Tic Tacs in a pill bottle, right? Like, I mean, that's not really what needs to happen, like it's just, they can get a pill bottle. So that's not very helpful. So I try to tell youth that when I give youth this information, they all are like, yeah, Kelly, I know. Like, even the ones that don't use opiates, or really even like meth or cocaine, they maybe just use marijuana or nicotine. They know this, which is disturbing to me when I see them in the hospital and they're here for an overdose. And I'm like, ah. So oftentimes I still tell them, I still go over it and just kind of, hey, if it's not from a pharmacy, assume it's fentanyl. Even if it's in a pill bottle, like, just, assume it's fentanyl. But I do educate a lot of parents on it, and providers and stuff. And I know that's something that y'all can do, is if you're out there on the front lines, it's just getting this information out there. Even when the kids say, I know. It's like, it's serious, okay? It's 50 times stronger than heroin. This is not something to mess around with. And so just kind of getting that out there, and, kind of doing that. So yeah, characteristics. So this site down here is where my next couple slides information is going to come from. So I put this number out here. I was glad I was able to get the screenshot so you can just see how dramatic. Because when I tell people that up until 2018, we were in the single digits with, so these are overdose for people under 20 years old. And I don't think King County always had this information, because I was trying to find it at one time and could not, but they do now. And so when I say we're in the single digits before 2019, I mean, it's 4, 3. I mean, in 2010, there's 7, which is kind of the highest it gets until 2019. So yes, this was an issue. And these are not specifically like, opioid overdoses. These are just overall. But, in 2019, we see that spike, triple to 13, which is when I really started noticing in the school that we had a lot of high schoolers this happening. 2020, it went up. And then I did just recently check, it's still 2022 for 2021, which I was kind of surprised, even though the numbers, as we'll see, for 2021 are a lot higher. But it's out there. It's yeah, it's not fun to deal with. So I have, my friends that are in the field, and we'll talk about treatment like myself. And we're often, abstinence based. With youth, but I'm always open, harm reduction. I'm always open to whatever the youth's willing to do. I'm very motivational interviewing kind of style. Um, but now a lot of my friends that are in the field are just like, we're just doing death prevention at this point because they're just seeing so many youth either die or have to end up in the hospital from an overdose. So the trends in King County, I pulled this information on the 19th. So I mean, it's not that old, but I did go yesterday to the site to just check, and that 2022 number of 26 is now 42. When I checked yesterday, and these, confirmed, and all these are just a little bit different, not significant enough for me to change the whole slide. But as you can see, the upward trend, I think we know like 2020. Obviously, I was kind of, I mean, 2020, I was kind of surprised it was not higher, and this is just King County numbers. And then they kind of, if you go to the site, which the link's below, and you hover over the color, it will tell you the number. And so since I can't do that on the slide, I put them here. And so what we're really seeing, kind of the big trend, is that purple, the stimulant and opioid together. Now, clearly people are still having just pure stimulant overdoses, and other drugs that they're overdosing, and the alcohol, which is pretty low, but still always a danger. That we've got the majority that are opioid related. Other 506 of our 714 are opioid, and 360, I think now it's 362, are confirmed fentanyl. And so that's just a big chunk of that that's happening out there. But like, yeah, you see really that purple line is kind of what drew my attention. I have had that pointed out to me because I was like, wow, I just didn't think the stimulant opioid, like the combo, I always kind of think pure opioid. But yeah, it is possible to kind of track that with this link, and I do appreciate it, even though it's not something I want to hear. 2020 was kind of interesting, just to hit the COVID stuff. It was kind of interesting because we still don't really have good numbers on it, but it seemed like, because with youth, a lot of youth were staying home more, and so we kind of saw some youth use go down. But then as like lockdowns and things continued, started to kind of see it get worse. So it kind of was like, it was initially, I was really curious. I kept thinking, oh, the numbers are probably way up. And they kind of found like, well, kids were kind of closer to home and people weren't going out as much. And even though there were still nefarious activities going on in the world, it did seem like it kind of went down, and then it's just kind of blowing back up, especially with like depression and things like that. This is just a King County thing. It's been out since like 2020 that fentanyl has been found in black tar heroin. I still hear some people from King County saying it's not really in black tar heroin, but I'm like, your little flyer says different. And it always has those blues on there, and some tips for, to avoid youth using alone, having naloxone and overdose. And see, something else y'all can do is letting people know, that, I mean, if they're in the hospital for drug use already, they know that the police haven't been called, that they're not getting arrested, and that, that they should come for signs of an overdose. They should bring their friends. They won't get in trouble, and just kind of that information being out there. Treatment for opioid use disorder, the medication, the outpatient, the inpatient. I'll kind of go over this just so y'all have an idea of what's out there. The MAT, medication assisted treatment, or medication opioid use disorder treatment. I'm sure y'all kind of know about these, but the classic, the methadone, and being someone that's worked with a lot of youth, I didn't have a lot of interactions with people on methadone, but when I've worked with adults, and then some trainings. And, there's some people that are on methadone for life. That wasn't really the original intent of it, but perfectly successful people that, are doing well in life. And, it's not entirely a bad thing. It will work for some people. So I'm always kind of open to that. I think the more popular choice, especially at this point, is the Suboxone. Um, and that, is being used for youth now. I mean, 5, 6 years ago, it was really hard to find a provider, but now the inpatient providers in the state for substance use treatment will accept patients on Suboxone. They will help manage it. So it's kind of turning around. My friend that works at Orion Center, and they will go to anywhere in King County and give a youth, get them on Suboxone, or they prefer the Sublocade, which is the injection, the extended release, so that they're like good for like a month. They'll run around and do this for anyone. They don't have to be homeless youth. They'll work with families. They're finding, from what they've told me, this is not scientific information, but what they've told me is that you stay on it like maybe 2, 3 months, that it is helpful for them, but they don't need to be on it, kind of forever, like kind of methadone was. At my side job where I work with adults, we have a lot of people on Suboxone, and they always are trying to get off of it really fast. But I've seen better results with people that kind of stay on it a little while longer, like 3 to 6 months. Or again, if you're on it and your life is going okay and you're functioning, you know, um, something to work out with the doctor if needed. Um, the antagonist treatments, the kind of blocks the pleasure, the euphoria, the Vivitrol, and those types of things are also, used with youth as well, and they can be really helpful. Um, then there are other kind of treatments for opioid use disorder. The big thing in the literature that's going to keep pointing to is the contingency management. And so this is kind of like somebody gets a reward or like a gift card or something for coming in to doing their treatment. And I mean, it is effective. It's great. The problem is like, where do you get the money for the rewards, right? So like, this would be great, except I don't have access to go buy gift cards or have a prize closet kind of thing. And a lot of agencies don't at that level. I did work with one, they're obviously not here anymore in Seattle, but one program that did this, and it was very successful. And like the youth would come in and they kind of had like a prize closet. And for coming in, for showing up, you got something. Like that's all you had to do was show up for the appointment. If you wanted to, haul tail out of there after, fine. But you got something. And then it was kind of like, okay, did you do your homework? Did you do this? Did you participate in the session? Let's go back to the prize closet before you leave and get something else. A lot of adults, they do like Safeway gift cards, things like that. But this has been shown, especially in conjunction with like medication management things, to be really effective. It's kind of hard to find. The others, kind of things you probably know about, like CBT, cognitive behavioral therapy. This is kind of where I live a little bit, along with the dialectical behavior therapy, of just, kind of looking at thoughts, looking at behaviors, emotions, kind of working those out. And, a lot of people that suffer with addictions, especially like opioid, there's a lot of shame involved. If you have someone in your life that's struggling, it's hard on you for sure. It can bring up a lot of anger and things, but remembering that they're sick with this brain disease of addiction, and there's often a lot of kind of regret and shame with that, and so kind of working through that in a therapeutic way. And then there's a lot that is growing in popularity, and you're able to find around here, peer support. And that can be, like at agencies, it can be unpaid individuals, and kind of having that interaction. I would kind of almost put like AANA in that category a little bit, of those things. But yeah, so peer support is getting to be much more popular, and one of the places I refer does a lot of that. Here's some of the kind of treatment resources in Washington State. It's not a exclusive list, but Sundown, they treat adults and youth, male, female, Yakima. They're a great program. CMARS won the male programs in Seattle, female in Bellingham, and these are female like identifying, so they will take transgendered youth at all of these facilities. Daybreak Youth Services in Fresh Prairie, Vancouver, and Spokane. We'll talk about in the next slide a little bit about the family-initiated treatment. And Daybreak currently in Washington State is the only place that is doing that. So that's a really new thing in substance use. So if you're familiar with our mental health side here at Children's, we have someone can come into our PBMU voluntarily. So they sign themselves in, the youth. They can come in with a FIT, a family initiated treatment, so their parents can actually sign them in because they are a danger to themselves, to others, or gravely disabled. Or we have to do an involuntary commitment and actually a legal procedure to get them, like, you have to stay here, you're on a hold. And so that's for mental health. So the side of substance use inpatient has been voluntary in Washington State. Now, other states have different ages of consent, so parents can take their kiddos there if they can, afford to and all that. But in Washington State, it's been voluntary, and that's kind of been it. Voluntary, and then sometimes, like if it's kiddos on probation, you get the treatment or jail kind of thing. So if you want to call that voluntary, which I would, because I've worked with a lot of those youth, and that's actually been very successful. However, where parents can actually go, I'm going to sign you in to treatment. The only place that's able to do that currently in Washington State is Daybreak. And it's going better than they thought. When this first started, they were really like, oh, like, this is hard. Because when you do, I've worked substance use inpatient, you got to have some kind of buy-in. And if someone's like, I'm just here because my parents made me, it gets tough to work with. But they said they've had some people that have been kind of like on the fence, which is a lot of times with addiction, right? If you've ever dealt with someone that has addiction, they'll tell you one day, yeah, I'm willing to get help. And the next day, or even the next hour, no, I don't think so. And so that's really common with substance use, where it's kind of like, yes, no, yes, no. But Daybreak will do that. Excelsior right now is not accepting anyone. I just talked to them today. But they're supposed to have like the beds for Ricky's Law we'll talk about. And then the big thing in Seattle, which I work with, is Bridges Alternative Peer Group. And this is great because they do have peer counselors there. They do a really great program. This is in Greenwood, Finney area. They do a great job. Ryther, I send them youth there for a lot, for assessments, outpatient. There's some places that do medication management. And then at the bottom, there's self-help groups, which, AA, NA, Smart Recovery, all these types of things. And I always like it because it's free and everywhere. We talk about access barriers to treatment. Okay. Self-help groups are free and everywhere. But also I get more pushback about this from adults than youth usually. I have a lot of youth that are kind of interested and they're willing to check it out. They like it. It's very popular, especially like the Bridges program. They really promote people going to their own self-help groups. And they're pretty big into it. So when I went back when we were able to get out a little bit more in September to their open house, it was so nice to see all these youth that were in recovery that kind of had that, oh my God, AA speak, they're like, I'm working my program, I'm talking to my sponsor, I've got to do these things. It was really nice to kind of see the other side. I don't always see when I'm trying to pressure kids to go. But they're pretty open to it. And then the Smart Recovery, the youth stuff, there's a ton of great stuff online. So it's a good thing. Treatment resources, like I mentioned, Ricky's Law and FIT, Family Initiated Treatment. So Ricky's Law, community members that are a danger to themselves or others because of addiction or substance use can be kind of involuntarily committed to a secure detox. Okay, that's a great law. Give me a youth secure detox. Yeah, I was just talking to a social worker this morning that was like, I was like, well, we don't have involuntary commitment for youth. And she was like, well, we do. It's Ricky's law, but there's nowhere to send anyone. So I guess we do and we don't. And I'm like, yeah, okay, I can be technical. We do have the law. We just don't have anywhere to send kids. And so it's like, yeah, we have this law. There are secure detox beds for adults. But then again, it's detox. So you keep them there for that. Sometimes we do that here in our own hospital. We're keeping kids till they're kind of medically clear. And then you can't really hold them much longer than that unless they are like, deemed that they're a danger to themselves. And so that's been kind of hard. Excelsior is supposed to have 8 beds. I should update this. They don't. And then you have the family initiated treatment where you can have them signed in to inpatient treatment. And there's some stuff for this in outpatient as well. I don't touch on that as much because I just don't deal with it that much. And I'm not really sure about how successful it is. Usually, I mean, I see a lot of kids that don't want to be seen, right? So I just try to do some motivational interviewing with them and get them on board in some way, develop a relationship. And then when they are ready, I can kind of be the person that facilitates that. But yeah, and then this is the family initiated treatment, which, they do have to get assessed when they're there. They're there for 3 days to do the assessment. And if you have a savvy kid that's like, I'm not going to talk, it's hard for them. And then I think 28 days they can keep them. So it's an option. Just kind of touching base on the Narcan and everything. I know I've mentioned that. The naloxone, Narcan's the name brand. Every time I do this training, I mean to bring a box. I'm so sorry. But it is legal for everyone in Washington State to obtain, carry, administer naloxone. It's totally safe. You can give it to a pregnant woman. That's why I'm kind of like, I know there's some people talking in the chat. They might know more than I do about the schools, but I'm just like, hey, get this, let's go. And so in King County, you can you can order this online through the Kelly Ross Pharmacy. And I did this just to see if it worked to my house. And the link is here, or you can Google laced and lethal King County and find out more. They are working on a statewide program. I just talked to them, I think last week, because I was trying to get naloxone for someone in Snohomish County. Here at the hospital, we're having to put this in the emergency departments, or having to give this out for anyone that's at risk. I'm able to do this on consult and with my clinic patients, but they're mostly telehealth, and so the order online is a great option. I've even done it for families and said, "Is this your correct address in Epic? And is it okay if I order this to your house?" And they're like, "Yeah, you'll do that." And I'm like, "Sure, I'll just," because it's really confidential. They just need an address to send it to and a name. And then they do ask for the age. It was kind of initially for, this program to get that under, those numbers we're looking at that are really bad for the under 20. But they will do it for any age. I had to put in my age because I didn't have a child. So it's like, say my 16-year-old. I do usually ask them to put the age of their youth in there just to help them with the grant. But that is possible. There are always kind of rumors that they're running out and there's not enough. And I hear that, but I haven't actually run into it. So hopefully that's not the case. But yeah, if you Google laced and lethal King County, it will come up and you can, go through and figure that out. I did leave y'all with some resources. Just like the Washington State Recovery Helpline, you can call them and they'll tell you kind of a lot of the same stuff I'd tell y'all, or you can, call me. Yes, they do. Pharmacies will take insurance. It's covered by Medicaid, but it's some, like if I went, with my insurance, I would probably have to pay like $100 or something to get it. So it doesn't necessarily is always like covered by insurance, but the insurance was, well, maybe you can check. I know one of our docs went to go get it and it was like $120. So it's not necessarily always like available for no cost out there. And then I saw another question pop up. The Kelly Ross, the order online is right now currently only for King County. But like I said, King County told me, they said the state is trying to expand the program so they can do that anywhere. And then I also heard in Spokane, they're going to have like Narcan, like vending machines and stuff like that available. So I don't know if that's gone into effect yet. But yeah, there's some numbers here. The teen link y'all probably heard of, that they actually have teens on call and chat a few nights a week. Encouraging patients and parents to safely oh, awesome. Y'all have it in Moses Lake and Wenatchee. That's cool. But yeah, encouraging parents to safely store medication, because we know a lot of people, youth and, they get initially addicted to opiates by taking pills, stealing pills, that's kind of where it's often starts. When I worked at Harborview in the emergency department, I asked everyone under 25 that came in with heroin addiction, I would say, how'd you get started? And I wish I would have kept a tally, but 100% of them said opiate, like pills. They, either had them prescribed or were, just trying them at a party and got into them. It was 100% of them. I just don't remember how many I talked to, but it was quite a few. And then the Kelly, so encouraging, med return, lock boxes. We have lock boxes here at the hospital we give out. And then the Kelly Ross and all that. And so I think I've got time for questions. I'm so excited because I like interacting with everyone. And so I don't know if you want me to stop sharing so I can see
read them.
You'll read them? Okay.
Yeah, I can read them. Some of them are coming through Slido. There is one that comes to mind. I know kids are smart, so can you speak to creative ways they are hiding drugs both at home and in school?
Yeah, it's yeah, they are creative. The vaping is really hard to get, to find out, because our big thing, especially with marijuana, the thing we had going was the smell, right? It's very pungent smell. So now with the vapes, there's not much odor. So a lot of parents, like I said, I've had to work with a lot of kids that parents found the vapes. And that's really where they were like, oh, okay. But of specific hiding places, I don't know. I had one kiddo at school who had drugs on her, and they checked her backpack and they did not do a thorough enough search and did not find the drugs. And it was killing me because I'm the drug and alcohol counselor and I want to break confidentiality. Like I did tell the security, like, make sure you really, really check everything, because they were in there. I kind of stepped in, they were in the office and they were crying, and then nothing happened. And later, when in our session, they were like, yeah, they were in there. They just didn't check that bag, that spot. So they're clever. I don't know of any like current, like, Band-Aid box they're doing. But they are clever. And I think really the vaping is what's kind of putting us off.
Mm-hmm. And then any strategies for managing chronic users so they're still able to access their education and don't just drop or fail out?
Yeah, I mean, I think, encouraging them. I mean, what I do a lot too is I encourage youth. I have a lot of youth that are, they typically want to do well. They want to finish school, even if they hate school. They want to go. And so what I did a lot in the schools too, which I didn't always find the schools doing as much as I did, I felt like, is really helping them know their options too. That, like I worked at a school that fed into Ballard, and talking about their like maritime program and those kind of things. A lot of the youth I work with, a lot of them are really into like auto shop and car mechanics and those things. And so one of the things is just letting them know that it's not always going to be just school. And so kind of looking into those things, and trying to get them interested, maybe in a different way, to keep going. It's, sometimes if, you get youth that are like, it's not the weed, it's not the pills, it's not because I'm doing this. If you can even give them a challenge, like, okay, well, let's not do it for 3 days and see how things go. If it's that easy, they might, I don't wanna, but sometimes those things, but yeah, it's really hard to keep them motivated. There are also, the things that are online, the credit retrievals. I have a lot of parents that really kind of pursue those things to help youth not feel so like behind. Um, yeah, that's helpful.
And then, is there a tolerance with methadone or Suboxone, where it requires a higher dose to keep patients compliant with treatment?
That's a really good question. Not that I know of. A lot of times, especially with like methadone, they're actually usually trying to lower their dose. So I know some people that are like on a certain, amount, and they can't go below that because they'll just relapse, but they don't have to keep going up. And I don't think there is with the Suboxone. But I'm not a doctor, so I'm not sure. But I usually hear the methadone people that are like trying to go decrease, as opposed to having to increase.
Mm-hmm. Okay. And I really appreciate everyone's comments in the chat about resources on how to talk to your kids about fentanyl and the Lace and Ledo conversation guide. So I think those are really great resources that you're all sharing. And I, I think when you spoke about, maybe it was in a different talk, but kids will try, some are very high functioning, they can maintain their normal life and still be a user and still be addicted. And so what are some signs for those kids where you're like, should I be concerned?
Yeah, I mean, I think the diagnosis criteria, kind of just like always looking um at life and what, like, the changes. It is hard because with teens, it's like, okay, what's normal kind of teenage behavior, like defiance or wanting to do something different versus what's someone is getting addicted. Um, One of the biggest things I've seen, and this is pretty consistent throughout my time, is if youth, I like to do rewards and consequences, so like, okay, if you're doing this, you can get this, or trying to figure out like more rewards, but like really, what's your child want? What are they desiring? A lot of times it's nothing because they have everything, but trying to be like, if it's even a privilege, it doesn't have to be monetary. Um, but when I have youth that are like, all I care about is being with my friends. That's all I care about. Like, it's nothing else. I don't want money. I don't want phone. I don't want car. I don't want, all I care about is being with my friends, when they're really almost like, I mean, obviously it's normal for teens to be into their friends. That's like, I mean, that's not an abnormal thing. But when it's almost a fixation, then I get very concerned. Then I'm just like, okay, they're using. Like, if they have to see, their friends or a certain friend like all the time. I mean, sometimes there's, maybe a romantic thing there, but a lot of times it's a big sign for me when it's like this kind of like, this seems a little out of the realm of normal. Um, and then again, like, loss of interest in things that they were interested in before is always a concern. I do have some youth that are like, I wasn't interested in this, Kelly. I didn't want to play, piano, but I told my parents it was fine, and now I'm speaking up. Okay, that's one thing, but like I said, like my soccer kids that were really into soccer and then they quit playing, and I'm like, that was like, you like that. I'm not convinced. Sometimes those are really big kind of signs too. And also, the just kind of physical signs that you see of the like either being really tired, being sick all the time, it's always a great excuse. All those kind of, oh, I have chronic headaches, I have this. Um, those are kind of concerns that stand out for me.
Okay. And then the last question, how are methadone or Suboxone helping with opiate addiction if we experience heroin not being a good choice for morphine addiction?
Absolutely. Um, so they're a longer release. So there's not that like high that you'd get, like, you know, if I were to smoke, take heroin in any way, I'd get like, you know, feel this feeling of high. These are more like extended, and so it's almost like kind of like a nicotine patch in a way, like where you know you they don't have to experience that intense craving that they get from opioids and things like that. So it's kind of it helps in that way because they're not necessarily getting that high, but they are maybe if they have pain, especially with this like Suboxone, like it does help with the pain if they have that. And it's just that the kind of extended release. So it's a tool to help people. I don't typically like it when they're not in treatment at all and they're getting these things. But it's yeah, oh, I see another good question. Yeah, so it's kind of like that um, out there.
Hmm. And then, what drugs are most popular to give to trafficking victims? Are you seeing anything that more, you know,
To give to what victims?
sex trafficking victims?
Oh, um, yeah, I did actually used to run a group home for kids coming out of sex trafficking. And I pretty much saw the gamut on that one. I mean, it is currently a lot of opiates and things, but there was also a lot of like methamphetamine addiction and cocaine. Sometimes it's with the stimulants and things like that, it's just whatever's available at the time. Sometimes we have times when there's a lot of cocaine in the community and then there's meth or there's not. And so those are kind of sometimes just what's available. So we see a lot of stimulants with trafficking victims, but you know, they can get into opiates as well.
Mhm. And then just a last question. What about brain changes in with chronic opioid exposure? Any permanent
Yeah, I
changes
mean,
that
I
we're
think
seeing?
yeah, just quick, I see our time. Yeah, I think there are, I mean, I think really what the biggest changes are like why we do have people on the medication assisted treatment because they kind of are getting like their 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 addiction part of their brain gets so stimulated, these drugs are so strong that a lot of times it's really hard, especially if people are using young as youth. Your time in your brain when you're learning to use coping skills and you're strengthening pathways, if all you're doing is are drugs to deal with stress, you get to 25, 30, 40, 50, and they're not able to really do those things very well. And it's really hard. So we see things like a lot of anxiety and a lot of depression, and those things just because you've kind of trained your brain to keep using a drug to feel to kind of soothe yourself and you haven't really developed those other skills and by this time your brain is maybe too old to teach that dog new tricks, and that's sometimes where the methadone, the Suboxone, those kind of things are helpful. Like I said, for youth it's usually a little bit of time, sometimes for adults it's longer.
All right. Thank you so much, Kelly. You've given us a lot to think about.
There is
And
hope out there, I promised.
yeah, yeah. And it sounds like, you know, kids are getting smarter, and drug dealers are as well. So just be cognizant of what's going on out there. And I really appreciate your perspective and your experience with working with the kids.